As I mentioned in a previous video on American healthcare costs, I addressed on the issue to do with the American Medical Association monopoly, the overregulation of the private sector, and the third-party payer system. As I stated, the third-party payer system is anti-capitalist, it's anti-free market, and again, the free market's where the market strongly regulates itself, unlike that of the American healthcare system where you see it's overregulated. Through the free market model, you have the straight transaction between the consumer and the provider. So the consumer gets to shop around for the cheaper cost. The consumer isn't forced into this third-party payer system. What the third-party payer system means, it means that someone else other than the consumer gets to determine the cost. So the cost is monopolised in the hands of third-party payers, in the background, in the hands of third-party companies. The whole thing with the free market is the consumer is king. The consumer can shop around in a fiercely competitive private marketplace, and they can find the cheapest provider, the best service, and of course who they trust. And it's that straight transaction between the consumer and the provider. It's not based on this third-party payer system. Now, there is actually a free market model of healthcare today in the United States, and it's known as the direct primary care system. So what is this direct primary care system? Well, if you can think of things much like that of a gym membership, where you pay a monthly rate fee, a flat base rate fee, and part of that membership, you get access to everything with it. Maybe even in some gyms you get access to even the spa facilities and stuff like that, and certain other things depending on what the membership covers. I mean, all the equipment you've got to think about, and the expense of such equipment, and I would imagine the weight equipment, etc. is very expensive, and especially the rowing machines, etc. So this is basically what healthcare in the free market is based around. It's based around this membership model, where it's a flat base rate fee, whether monthly or yearly, and you get everything of access.
If you want to live a long, healthy life and want convenient, 24/7 healthcare from a doctor who is dedicated to both keeping you healthy and minimizing your out-of-pocket expenses, all for less than the cost of your monthly cell phone bill, then your best shot is to become a member of a direct primary care practice.
Now here's a prime example from a medical doctor, Josh Umbehr.
It's Marcus Welby Medicine with an iPhone, because it's going back to what a lot of people remember from their doctor in the old days, where they worked directly with their doctor. There was no insurance. You paid in cash or chickens, and your doctor took care of you. But our system, we've now, tomorrow will be our 5-year anniversary, and we started with the idea that we have insurance for the wrong things. We don't have car insurance for gasoline or homeowners insurance for lawn care. I have health insurance for family medicine, the bulk of what most people need. And we were able to remove that middleman, the third-party payer. We structured it a little different on the billing side, so it's a flat rate per month based on age, just like a gym membership. And for that membership, you get unlimited home visits, work visits, office visits, technology visits like email, cell phone, texting, Twitter, Facebook, Skype, basically whatever we want, because now we're not limited from what insurance will allow or pay for. Then we have no copays in our office. Any procedure we can do in the office is included free of charge, because that's what the membership is covering, just like any equipment in the gym is included at the base membership price. So stitches, biopsies, joint injections, ultrasounds, bone scans, lung scans, urine testing, strep throat testing, minor surgical procedures, all included for free.
Now the amazing thing about this is, if you were to contrast this to the universal healthcare system with that of the likes of the NHS. The NHS is faced with the massive big long waiting lines. You'll face all the excuses about, oh, it's just underfunded, etc. I've already covered all of that. The NHS is inefficient because of the absence of the price mechanism. So in other words, the absence of profits and losses. So because it's fixed at free at the point of use, there's inefficiency. What you're faced with is quality deterioration. In other words, when you make something so-called free, you tend to find people abuse the system. People who otherwise didn't really need treatment start to seek treatment. They take up doctors' valuable time. And unfortunately in the NHS, doctors are faced with a massive backlog of patients to see through. Not only are the best doctors leaving the NHS, leaving the country to better healthcare systems, but also they're spending less time, fewer time per patient, despite the fact how long, certain patients may wait. As a result of the massive big long waiting lines, the NHS has had to contract out to that of private companies. But the beauty of the free market model, as Josh Umbehr had explained, you have the opportunity, you have the unlimited work visits, office visits, home visits, all of these things. You even have the electronic communication, etc. There's a medical doctor who also works within this direct primary care system, and he explains how he manages to get through so many of his patients and free up so much of his time. There's so much less stress. But not only that, they're able to spend up to an hour, even longer than an hour with patients, and that's because of this issue. And why is that? It's because of the fact that they're able to, see through so many of their patients through electronic communication like Twitter, like Facebook, like Skype, etc., etc.
It's the 21st century. So we give you the tools to reach us from your home, your car, the office, the store, or even out on the beach during your relaxing vacation. The goal of DPC is to make it easy and affordable to get the help you need whenever and wherever you need it.
And it allows these medical doctors to free up their time, more time to people that might have more serious issues. One of the things to address on the direct primary care system, as Josh Umbehr has explained and several other of the medical doctors, they removed 80% of the health insurance. Most of the medical insurance really is unnecessary. Have a listen to what Josh Umbehr states here.
The idea again that just insurance isn't bad, but it wasn't helping. It's a tool, and we want to make sure that we use that tool correctly. You don't have car insurance for gasoline, life insurance for groceries. So why fundamentally are we using health insurance for outpatient care, family medicine, internal medicine, pediatrics? And so what we said is, let's develop a better system. And as we worked through the process, we saw that there were lots of options. I'd been watching concierge medicine since 2000 when I was an undergrad. And it started off, of course, the high price model that was probably not a doable model for most patients or most doctors. They just didn't see themselves fitting into that piece of the system. But like most innovation, it starts off expensive and gets cheap. I was reading some fun technology stats the other day, and in the 50 years since Moore created Moore's law about the speed of technology will double every 18 months, we've had a trillion-fold increase in processing speed. And in fact, a 1985 supercomputer is roughly equivalent to an iPhone 4. Which basically means we're all walking around with supercomputers in our pocket, and it's affordable. So in an analogous way, it had to start off maybe on one end that was expensive, but now the model has worked itself out so that it's applicable to the masses. And that means doctors and patients, that we can all take care of the populations around us in a meaningful way.
So as I say, 80% of the health insurance is removed because it's unnecessary and it's used for the right types of jobs, which would probably be that of more serious issues. And so, as a result of that, they were able to reduce Americans' healthcare costs by more than 80 to 90%. That is insane. I mean, you think about how much they're charging. Just listen to what he says here.
Something else we do that makes us very unique and valuable is wholesale medications, labs, imaging, and pathology. We had a perfect example recently. We ordered some blood work. We have our negotiated cash discounts of usually 95%, and a patient's blood work was accidentally billed through the insurance rate because of a computer mistake at the lab, and the price that they were quoted was $1,028. We ran that back to our system. It cost $39, a 97% savings by just cutting out the middleman.
Because of removing most of the health insurance, and because of removing the third-party payer system, in other words, removing that middleman, and having the straight transaction, having the competition, it's enabled not just far better quality for the consumer, it has enabled them to dramatically reduce Americans' healthcare costs. And here's the thing. How come most people don't know about this? The mainstream media doesn't want you to know about it. They would rather use the main American healthcare market as a political football. It's in their interest to say, oh look, here's where capitalism isn't working and therefore here's why we need socialism. That's really all this is about.
We built our model, just to summarize it real quick, again, membership, because that simplifies a lot of things, but $10 for kids, $50 for most adults per month, for unlimited home visits, work visits, office visits, and technology visits. So that includes text messages, emails, cell phones, Skype, FaceTime, etc. No copays for anything in our office, because really that's what the membership is for. And the whole goal here is kind of like Costco. You have your membership once, and they keep building value into that to protect and support the reason the customer buys the membership.
You contrast that to what Americans are currently forced to pay in the main American healthcare market. It is insane. So let's have a look at some of these comments. Gamificast says, it's funny that some people hate for-profit systems, yet those exact same people have absolutely no problem at all with MPs taking their hard-earned money against their will and helping out companies that were forbidden to make profits for 4 months of lockdown by those exact same MPs. So their logic is basically profit is bad, but companies need money. You know, I've long argued, like I even argued with Danny Deschamps, I wouldn't really call it a debate. I would say I'm now anarchist. I just don't have the same knowledge and depth. I think that's really always been the case, to be honest. I've always been anarchist at heart. In his video, he does mention, obviously, a number of important points. And of course, the whole thing on the coercion was brought up, and like I said, about government going on the path of its own. I do acknowledge these things. And the serious issue with this of government itself, you only have to give it a sniff of taxation and government will go on the path of its own. You saw that with the private turnpike industry in the 19th century. Government ended up, you know, building roads out of its own self-interest right through people's own private farmland without even their consent. You know, they ended up causing bankruptcy, etc, etc. It was against the consumer, and it's no different with that of taxation. And they're so hypocritical. They'll say, oh well, you know something, it's a for-profit system, therefore they won't care about the patients. That is just complete opposite of the truth. When you put money into the hands of central government didn't have to work for your money, so it's incompetent with it. It can be wasteful with your money, and it is. The NHS is wasting £7.6 billion per year, and that is because of government. That's what happens when you allow government to tax you. Government's incompetent. That's the first thing. The second thing is the fact that government fills its own pockets. Look at the MPs and look at, their wages. Look at how much they're earning off the back of the taxpayer. And this is what really makes them hypocritical, because these same people every 4 years turn around and say to you, we've got a self-serving Westminster government that really only cares about its own self-interest. Well, that's governments. It's hypocritical, and the other side of that story is the fact that they don't understand profits, and losses are just as important. And as I reiterate again, profits and losses are price signals. If you don't have the information of these price signals, you cannot operate anything efficiently. It's the primary reason why the NHS is so inefficient. When you're dealing with people's health, time is very valuable, and that's not something you can afford to just waste. And unfortunately, that's what happens in the NHS. When it comes to contrasting the NHS to this whole direct primary care system, the free market gives it a showing up. It really does. Requiem Act 7 goes on to say, this is a very good video. I certainly learned a lot as expected. If you don't mind me, may I ask a question? Forgive me for sounding ignorant. While I'm against universal healthcare for multiple of reasons, my family came from Vietnam. After all, this is an argument I hear a lot around socialists. Unquote. If healthcare is so expensive, then why make the government use the military defence and police budget, give it to the healthcare system? The defence force budget is already too bloated, off quote my socialist friends. I don't know how to respond to that, and I even ask myself about that possibility. What they're completely ignoring is the very fact that the NHS has been continuously increasing, because they say the NHS is underfunded. It's just complete nonsense, folk. The NHS has had billions and billions poured into it every single year. The NHS budget is continuously increased year in, year out, and the issue with the NHS is the level of inefficiency. But despite the fact that it's failing, they wish to continue on throwing money at it. And you know what's going to happen. This is predictable, by the way, because you can read them like a book. What will happen is they will blame Boris Johnson. They will blame the Tories just because the Tories are in power. They'll say it was all the evil Tories' fault. They just didn't do the right thing. The issue is government itself. The issue is you made it free at the point of use. You destroyed the information of profits and losses. You can't destroy the information of profits and losses. and then expect economic efficiency at the other end of that. You can't. It's impossible. It's the primary reason socialism doesn't work. And this is the argument, because they're just basically saying, well, maybe if we just take money from another area of the economy, and what they're basically saying is greatly reduce your defence, even your security. By Christ, I mean, you're seeing this whole thing with defunding the police. It's crazy, right? It's crazy. The difference with Danny Deschamps, he came across with a strong, reasonable, logical argument. He said about having it in the private sector to the market itself and under anarchism, and I respect that. He even mentioned the whole thing to do with a deterrent, and I can reason with that. All they're doing is they're taking money away from one area of the economy that makes you safer, by the way, reallocating it to healthcare. To do what? To prop a failing system up. They don't comprehend the fact that you've also got this issue. The money doesn't just come from taxpayers' money. And it's like these, people, you go through education for what? To come out the other end and you can't find work because, government made things free prescriptions, free healthcare, free education, free tuition fees to the rest of Europe. Nicola Sturgeon. Honestly, why would you reallocate funding, defunding those things, to reallocate that into a waste where you're just going to waste the money? Why not just have strong funding for that, be able to dramatically improve the healthcare quality and dramatically improve that of just the overall system in terms of the costs? Wealth is not created by division. You cannot multiply wealth by division. Multiplication is multiplication. The only way wealth can come about is through production, and that can only come from that of the private sector. Pee-wee mentions thoughts on Jacob Spinney. Yeah, Jacob Spinney is obviously someone I've followed for a long while. Obviously he hasn't posted in a number of years, I don't think. He's a very intelligent boy. I think he just fell away and he just started doing other things, which is fair. Nothing wrong with that. And I even learned a few things from Jacob Spinney, and then I did more independent research and I found more and more on it, and I added him on Facebook before. I think he's still on my list of that. But yeah, he's a very smart boy. So anyway, folk, I hope this has been educational enough for yourself. If you've got any comments you would like to add, any questions or that, comment in the comment section below. Of course, be sure to like the video, share the video, and of course I shall talk to you later. Cheers.